Welcome to the first board meeting of 2026. If you are able, please stand and join me with the pledge. Good morning, gentlemen, and as stated, first meeting of 2026, so our next item on our agenda here is to have an election for the county board chair for 2026 in a moment, and vice chair. I will ask for nominations. There is no need to second a nomination. Once all nominations are received, we'll go to a vote. If multiple nominations are received, I'll ask for a hand raise on who you would elect to be the chair. And if there is only one nomination, I'll call for a unanimous ballot. And I'll do the same for vice chair. At this time, are there any nominations for the county board chair of Morrison County 2026?
I'll make a motion to put Commissioner Blaine into nomination.
So we have a nomination for Commissioner Blaine. Are there any other nominations?
I'll make a motion to close the nominations.
Okay, nominations are closed. This time is one nomination, so I ask to cast a unanimous ballot. All in favor of board chair 2026 for Morrison County, Commissioner Greg Blaine. Say aye.
Aye.
Any opposed? Okay, congratulations, Mr. Chair. And next item, are there any nominations for board vice chair for 2026?
I'll make a nomination of Mr. Casper.
Commissioner Casper has been nominated for vice chair. Are there any other nominations? Any other nominations? Closed nominations, and at this time, there's one nomination. I'll ask for a unanimous ballot. All in favor of Commissioner Casper as vice chair for 2026, say aye.
Aye.
Thank you very much, gentlemen. Mr. Chair, turn over to you.
Thank you. Thank you, gentlemen, for your support. Thank you, and to you, Commissioner Casper. Gentlemen, first, or next on our agenda is recognition of any additions or deletions. I look to our Deputy Chief Clerk. I see none. Motion is ordered to approve the agenda.
So move, Mr. Chair.
We have a motion by Commissioner Lemire and a second by Commissioner Casper to approve the agenda as presented. All those in favor signify by saying aye. Aye. Those opposed, the agenda is approved. Gentlemen, next on the agenda is the approval of the consent agenda. Is there anything that Commissioner would like to have pulled for further discussion? If not, a motion would be in order.
I'll make a motion to approve the consent agenda.
We have a motion by Commissioner Moran and a second by Commissioner Wincher to approve the consent agenda. Any discussion? Any discussion? Any discussion? Seeing no discussion, gentlemen, this is a roll call. Commissioner Casper.
Aye.
Commissioner Wincher.
Aye.
Commissioner Moran.
Aye.
Commissioner Lemire.
Aye.
The chair also votes aye. The consent agenda has been passed. Gentlemen, if you look at your agenda, we will go to number 7, approval of annual resolutions and appointments. And at this time, I will look to our administrator, Mr. LeBlanc.
Thank you, Mr. Chair. Gentlemen, before your annual resolutions and appointments, there's no change to the items listed that we've done in previous years, and I will go through the changes. In 7.1, travel policy, the county reimburses at the IRS rate for mileage. The rate increased from 2025-2026 from 70 cents to 72.5 cents per mile. That's the change in 7.1. There's no change in 7.2. 7.3, we updated state statute language and removed the times that were listed on that annual resolution. Code of conduct, there's no change on 7.4. On 7.5, the citizen staff committee appointments, we updated with any changes that have been reported, as well as if there are any changes to your current committee assignments on when they meet, and in any of that, please just let us know and we can make an amendment throughout the year. But at this point, all changes reported have been made. And on the AMC delegates, we have listed out myself as well as our Director of Health and Human Services, Nate Bertram, to be delegates for AMC, along with the 5 commissioners from Morrison County. On 7.6, county board appointments, that was the AMC portion. That's that change. On the county mileage, board mileage, on 7.7, there is no change. And on 7.8, elected officials' minimum salaries for 2027. I mentioned this back in December when we set our current elected officials' rates, salaries for 2026. This is for 2027 as minimum salaries, and this is required by statute for an election year. And it is an election year, so these rates were set for 2027 for anyone who may consider running for that position on what their minimum salary might be. So that's what those numbers are listed. Pending your questions, Mr. Chair.
Mr. Chair, I may have a question, well, I do have a question.
Commissioner Wincher.
Again, I know the answer, but could you explain the elected officials' minimum salaries again? It's kind of confusing in my book from years ago. So,
Yes, Mr. Chair, let me move to that page. No, it's wonderful.
for the people out in TV land.
Good. By state statute, and they're listed here, I guess I could read them, 387.20 subdivision 2, section 386.015 subdivision 1B, section 388.18, section 387.20 subdivision 2, section 385.373, and section 384.151. We're required to set the minimum salaries for the attorney, the auditor, treasurer, recorder, and sheriff. In determining what those minimum salaries were, and again, the rate that that an elected official is compensated is based on skills and experience and complexity of the position. How I determine this and bring this before the board today is these 4 positions were all evaluated by using our DDA, who classified the positions. We use that classification as a guide when determining these rates. What these rates are is each of those positions at step 1 of that grade on the scale. So that is where we determine these minimum rates of pay for an elected official. We don't technically use a pay table for elected officials, but we do use it as a guide as we evaluate that skills and experience and what the adequate or evaluated compensation would be for those. So I don't know if that provided more clarity. They are not, for example, if all 3 of our current elected officials are re-elected in 2026, the sheriff, the county attorney, and our current county recorder, this would not be their rate of pay for 2027. This would be the rate of pay if any of those individuals were replaced for the board to consider approving this coming December. And I should note, we will have an auditor treasurer, an elected auditor treasurer for 2027, so that, this will become part of a discussion here in December for our newly elected county auditor treasurer.
I appreciate that explanation, thank you.
Any further discussion to 7.1 through 7.8?
Make a motion to approve, Mr. Chair.
Thank you. Commissioner Lemire makes a motion to approve. Is there a second? There is a second by Commissioner Casper. Further discussion? Further discussion? Further discussion? Commissioner Casper?
Yes, Mr. Chair. I was just wondering, do we have to sign a conflict of interest form this year as well? Before we
Code
get
of
into
conduct?
the-
Code of
Code of
conduct.
conduct?
Yeah.
I think we did that.
Code of conduct's in here, Commissioner, and conflict of interest went out last month, and I believe we got it back from you, but thank you for the reminder.
Very good, thank you. Thank you, Mr. Chair.
You're welcome. Any further discussion? Seeing none. All those in favor signify by saying, excuse me, this is a roll call. Commissioner Wincher.
Aye.
Commissioner Moran.
Aye.
Commissioner Lemire.
Aye.
The chairman votes aye. Commissioner Casper.
Aye.
All those voting in the affirmative, the motion prevails. Next, gentlemen, number 8 is the bid for legal printing. Mr. LeBlanc.
Thank you, Mr. Chair. Another annual resolution here is we are required to go out and post for legal bid, legal printing for 2026. That notice went out and noticed properly. We received one bid in the mail from the Morrison County Record, and I will open it here for you. Bid for publishing local government legal items in 2026. The bid for the Morrison County Record line rate is $1.05 per line, and display ad rate is $8.76 per column inch. As a point of reference, last year the line rate was $1, so it's an increase of 5 cents. And the display ad rate this past year was $8.50, so it looks like an increase of 26 cents. We are required by statute to have local government publishing agency identified, and we received one bid.
Wishes of the board.
I'll make a motion to approve that bid
We
for
have-
legal printing.
We have a motion by Commissioner Wincher and a second by Commissioner Moran. Discussion, discussion, discussion. Gentlemen, this is a roll call. Commissioner Moran?
Aye.
Commissioner Lemire?
Aye.
Commissioner Wincher?
Aye.
Commissioner Casper?
Aye.
The chairman votes aye. All those in the affirmative. The bid for legal printing will go to the Morrison County Record. Gentlemen, next on the agenda, Health and Human Services. Good morning, Mr. Bertram. Ms. Effinger.
Good morning, Mr. Chair, Commissioners.
Good morning.
Good morning, Mr. Chair. Good morning, Commissioners.
I'll kick us off. Nathan Bertram, Health and Human Services Director.
Oh, Ashley Eppinger, Income Maintenance Supervisor for Healthcare and Long-Term Care with Morrison County.
Health and Human Services has a couple things for you this morning. First will be our METS, or Medical Assistant Programs Report, and Ashley will be giving that for us this morning, so I'll turn it over to her.
All right, thank you for having me. So what I wanted to talk about at this report is just kind of give you an idea of numbers. So if we go to the next slide, you can see the number of residents who are active on MA programs. So out of the 34,527 residents in Morrison County, 6,721 of them are on medical assistance. So that ends up being 19.4% of our population. If we go to the next slide, it'll just show you in the Region 5 totals, so we can see we're about middle of our region. You'll notice that in 2022 and 2023, those numbers were a little bit higher. One of the reasons that I would say the drop-off happened was there were changes in the COVID rules and unwinding period. So some individuals who were left on during that peacetime emergency then started to close off as we unwinded that emergency. There's two screens here. You can see the top one shows our cases that are active in METS, which is a system, the Minnesota Eligibility, sorry, I'm nervous, technology system. So these are typically for our individuals who are adults or parents and minors. The next section here, you'll see that MA cases active in our MAXIS system. That is our system that shows individuals who are disabled or who are elderly, or those who are on certain programs that allow them to have coverage that they would not get in this MET system.
I can just jump in real quick. Just the Maxis ones, so those are the cases that would be in the green screens that you hear talk about at the state level. It's got a lot of attention lately. MET system is significantly newer, not that it doesn't come with its own challenges, but I just wanted to clarify that the Maxis ones are that green screen that you hear referenced a lot in some of the state discussions lately. Sorry.
On that note, Mr. Chair,
Commissioner Lemire.
are they looking at getting rid of the Maxis system? Or not?
Mr. Chair,
Mr. Bertram.
Commissioner Lemire. Yes, I mean, there's been discussion of it in the pools at legislature as well as at DHS, DCYF, and at the county level. I think You know, there was some significant investment in the SSIS system in the last year and, well, 2 years if you add the 10 million from the year before. So that equals about 40 million. I think the hard part, the states let all their systems age, and at this point, to replace all of them is just an astronomical figure. I'm hoping the legislature decides to pick at something this next year. Maxis could be one. PRISM also has been talked about quite recently, and that's the child support system. And so we'll kind of see where some of that goes. I think I'll leave it at that for now.
Okay, thank you. Thank you, Mr. Chair.
Yeah, thank you, Commissioner Lemire. Ashley, please proceed.
All right, thank you, Chair. All right, so if we want to go to the next screen here that talks about cost-effective. So what cost-effective is it's for individuals who are open to MA programs but have access to other insurance as well. Typically, that's done through an employer. So many of our enrollees in MA are currently working, and so those individuals who are working full-time and have access to other insurance through their employer, we look to determine whether it's cost-effective for the state to reimburse that rate of pay through their employer insurance versus paying out to one of the plans that they could choose within MA. So currently with our MA plans that we have available are Blue Plus, UCare, and Medica. Those plans all have a capitation that the state pays out each month. So we look at the cost-effective insurance through an employer to see if that ends up being less expensive than paying out for those plans. When we look at the graph on the next page, you can see the dollar values
Sorry.
that
Get there.
that we show. I don't think that's
No, I'll get there, Ashley.
okay. No,
Give me
you're
a
good.
second.
All right, this one here. So if you look at dollar values, what is coming through our team currently for 2024 is the newest data that we have. So you can see that there was just over $500,000 that was paid out to those private insurers, to the employer insurance. And we receive reimbursement back from the state for that. Most years, we actually end up a little bit higher, but it goes on average based on when those pay stubs are submitted by MA enrollees. But you can see there are large dollar values, and so every dollar that you see there is a savings ultimately from the state compared to what it would cost if those enrollees were on other plans. Now, it's not a $5 million or a $500,000 savings, but there is a savings for each dollar because we're stating that these plans through the insurance companies through their employer is less expensive than the plans if we were to pay a capitation. Any questions on that?
Can I just ask you a question while I'm thinking of it?
Sure, thank you.
I know like during I'm sorry.
No, you're fine.
I know like during COVID, there was auto enrollment, right? Is there still any auto enrollment or have they eliminated that?
It's, in a sense, it's eliminated. Most of those rules have gone away. This next section is going to talk about some of the enrollees who are going to stay on programs that may otherwise have fallen off. But as far as when we saw those individuals who were maybe not otherwise qualified, who stayed on those plans, that has changed a bit. For MA purposes, it is a requirement if you have the ability to take employer insurance to enroll in that. And there is a rule that you would fall off MA if you don't enroll in that plan if we find it to be cost effective. However, we can't implement that rule at this time.
Okay, thank you. Thank you, Mr. Chair.
You're welcome.
Thank you. All right, and then the next section talks about some of our changes and challenges that have come in '24 for our healthcare teams. So the first one talks about mixed cases. So this is new this year, so going into the January of '26 renewals. There's two programs within that MET system that are potentially county work to be done. There's our medical assistance, but there's also Minnesota Care. So the difference between the two is medical assistance is an insurance that does not have a cost for those individuals in the system, where Minnesota Care would have a premium-based cost based on their income, and it would mean that they don't qualify for other insurance. So for those populations that have access to employer insurance, Minnesota Care would not be an option. So this year, the state has said that the counties now need to process any case that has a mixed, so both MA and Minnesota Care within a family. So for example, children have a higher income guideline, So there could be kids that are on MA and parents that are on Minnesota Care. Previously, the state handled all those cases, but for this year, they passed that on to the counties. So what that meant for Morrison County was an additional 80 renewals to be completed. For MA programs, it's typically done in a 12-month cycle, so if somebody enrolls April of 26, they would have a renewal in April of 27. For Minnesota Care, it's handled differently. Everybody has a renewal for January of 26. So there is no spacing, everything is all done. So if you enroll August, you're still gonna have that renewal in January of 26. There have been some new exceptions that have been created to extend coverage for individuals who would otherwise fall off. That happens for those children under 7. So if there's a change that would, if they're already enrolled and say their income increased, there was a parent's income that increased and they would fall off, they will not fall off. So children under 7 are remain eligible for those programs. And then for pregnant individuals, they also have a much higher income standard. Typically that would end after pregnancy. However, with this new exception, they are allowed another year with that higher income standard. So it, again, would otherwise not be eligible based on income, but they're staying on as long as they fall in that pregnancy income standard. One of the challenges with this is it does create workarounds for our team to have to meet those exceptions. The next section we talk about are asset limits. So again, as I mentioned, with that 22 and 23 higher rate that kind of fell, that was because now there are those asset limits implemented. So starting in 24 through 25 is when those renewal periods were done. So the COVID unwinding happened in March of 23. Starting in July of 23 is when we started the renewal process. So prior to that, from March of 2020 through March of 2023, there was no renewals for medical purposes. So if somebody was on, they stayed on through the COVID unwinding emergency. Then starting in 2023 of July is when those renewals started, but if they were enrolled, they had no asset test. Now, just to get an idea for our MA disabled and adult populations, MA asset tests are $3,000 and $6,000 for a couple. So if there's a disabled individual looking for MA, they can have a $3,000 in assets. We had many individuals who maybe moved to an assisted living or skilled nursing facility that had a home, that then that home sold during that unwinding period. They had excess resources, but those were not looked into until we had that July of 24 is when that process started. And we did it at renewal. We didn't do it all at once. So as the renewal came due, we would look at their assets starting in July of 24. So now all of that is back to pre-COVID. So our asset guidelines are still there now, and all of the unwinding has now ceased. And then the final piece I wanted to touch on was the annual health plan changes and challenges that have happened with UCare ending some of their program coverage and Medica dropping out of the SMBC Connect. So this gets a little complicated, so I'm going to try and, I tend to use a lot of acronyms, so I apologize and feel free to stop me and ask if you have any questions about those. The SNBC program, it stands for Special Needs Basic Care. That's for individuals who are certified disabled. So if they're certified disabled and have Medicare eligibility, they can qualify for a Connect plan. We call it integrated. Essentially what that means is it wraps their Medicare with their medical assistance. So if they have a prescription cost, that can be part of their medical assistance with the integrated plan. Now what happened in 26 is Medica acquired UCare, and so there were some challenges that happened with that. So anyone who is in this integrated plan now ceased to be as of January of 26, which means they now have to find a separate prescription coverage. They did auto-enroll a number of individuals into a Medicare Part D plan that is at no cost to the enrollee. However, as you can imagine, it's a lot of confusion for our residents who are losing what they knew as healthcare. With MSHO, that stands for the Minnesota Senior Health Options. That's the same thing. It's a plan that includes their Medicare coverage with their MA. That's specific to those over 65. Medica and UCare both ended that SNBC integrated plan, so there is no longer an integrated plan available in Morrison County. So anyone who is under 65 who has access to Medicare Part D will need to have a Medicare Part D plan, and they will not cover prescription cost. For those over 65, there are still 2 plans. They can have Blue Plus and Medica, but all of those who were open under UCare no longer have that option. Unfortunately, there was a number of changes that happened very end of December. So we are able to enroll individuals in a different plan if they choose to pick Medica or Blue Plus. Normally what happens is we would send that referral to the state and they would enroll them for the next available month. However, because there was such an extreme volume, DHS has a huge backlog. So we're not sure when those individuals will get to move to that new MSHO plan. So they've notified us if the request was submitted prior to December 31st, they will be enrolled back to January 1st. But we don't know how long that process will take for that backlog.
I'll just note the UCare, I don't know, being dissolved or being acquired by Medica, however you want to state that. I mean, that's a big change across the state. That's not specific to Morrison County. Excuse me. But it does affect 3,254 of our residents here in Morrison County. So it's a good chunk of people, so.
All right. That was a lot. I appreciate you listening. Does anybody have any questions?
Gentlemen, if you think that it was a challenge to follow all of this and all of the acronyms and that, I'll just say that this is one of the reasons we're blessed with the staff that we have upstairs in HHS. Staff members like Ashley that have to know this. They can't be like us and nod our heads and we're trying to follow this and there is a lot here, and there is a lot of changes that happened within less than the last 30 days, and these are significant changes here too. And I think, I just look at this, when you showed us the numbers, Ashley, of the number of people that are affected in Morrison County, and then just a chunk of that that are affected by changes that need to be dealt with by staff in January now, where this used to be sporadic throughout the year. Now all of that work has to be done here in this month. And of course, the state of Minnesota expects all that information and data back, even as they effectively just shift all that responsibility of work onto counties. So I'm appreciative of you being here, and you've done a tremendous job of helping us, and all of these board members, including myself, have the opportunity to continue to dig into this and ask questions of you and Mr. Bertram as we continue to try and get our arms around that. Commissioner Moran, you had a question.
Yes, Ashley, on the total number there, that pie chart said 6,700 total?
Yep.
6,721, and then the 2 graphs below that, you broke it down to adults and children, and then disabled. Should those 2 numbers match that total, or where's the rest of the?
That is a great question. So yes, it should. So let me see if I can pull, actually, I think this chart is from 25. Oh, I do have the numbers here on 25 as well. This is individuals. The bottom graph is cases. So on the top chart we see, and I did actually bring with client totals versus case totals, because there could be, say, a family of 7
Okay,
who is active
gotcha.
on 1 case.
Okay.
Thank you for asking. Yep.
Very good question, Commissioner Moran. Good catch. Further questions, Commissioner Lemire.
Thank you, Mr. Chair. On this policy changes, on challenges, on
Yep.
24-25, the new exceptions have been created to extend coverage for children under 7. So does that mean a child that's enrolled in MA when they're 1 year old is automatically enrolled until they're,
Correct.
until they reach age 7?
Correct. They would not
Regardless of
lose,
income of family?
correct. They would not lose eligibility.
And then, is that, previously, was it every year, annually?
Correct. They would be reviewed, or as changes happen. So if an individual reports an increase in wages, say they start a new job, that could potentially change an individual's eligibility.
So they don't even have to report income for the first 6 years then? Or do they still report income and it doesn't affect MA?
It depends on, so typically we see more than just a 7-year-old on a case. So typically those changes are still reported because there's other individuals on the case with them. But if it was a case of, we talk about auto newborns, so if a pregnant woman is on MA and then delivers a child, that child is considered an auto newborn, is automatically put on the MA program. So if it was the case of that, and then the woman with the pregnant status fell off because of income, that child, yes, if there was just one child on and they were under 7, it's my understanding that that child would remain eligible until 7, regardless of whether reports are completed.
And then it says, and pregnant individuals? So what,
So the and pregnant individuals, it's, that's a little bit different than the automatically stays on. So for an individual, if they're pregnant, they have the higher, it's not an auto eligibility, it just means that they get a higher income standard. So the income standard for a pregnant individual, I have written down as 275% of the federal poverty guideline. So it's much higher than, say, 100%, which is kind of typical for our MA. So they'd have a higher standard, they get to keep that higher standard for an entire year after they deliver that child.
okay, thank you.
Or, I should say, or lose.
If I may continue, Mr. Chair?
Yeah, please.
How long have you been in your supervisory position?
A year in December.
All right. Well, you're doing a really good job. You did a really good job here today. I know you said you were nervous, but it didn't come across.
Oh, I can
so-
feel my cheeks are red.
No, you did really well.
Done
Thank
very
you.
well.
Thank you, Mr. Chair.
Commissioner Wincher.
I'm gonna try to stump her, Mr. Chair.
Ooh, all right.
So, the question I have, and Nate brought this up, there's like 2,000 and some that are currently in limbo or with or without coverage, and I'm gonna try to, what is happening to, if I am one of them 2,000 and I have no coverage, or maybe I have coverage and I gotta go in to see a doctor, what happens to that person?
Yep, so I can try to help answer that. So I'm gonna start with saying the 2,000 number is total under UCare. So of that 2,000, it may not be all 2,000 that are dealing with these challenges that are happening. It's called PMAP, which is for individuals who are not elderly or disabled. That hasn't had a change in that program eligibility at this time. It may change once Medica fully acquires UCare, that plan will change. But as of now, their health insurance is the same. For those individuals who chose to have a separate Part D plan and didn't want to be on this MSHO plan, those also did not change at all. They remain open. So what we're looking at for those individuals who have had changes are those people who are open to Medicare as well and wanted to have it combined. So for those in the easy path, they have been enrolled in the non-integrated plan. So they still have the same insurance, they still have UCare, they just don't have the prescription coverage. So if they were to go to a physician, they would still provide their medical card, they would still have the same MA coverage in that sense. It's that prescription cost is what the issue is and what's hitting. They have enrolled them in other Part D plans. I believe when they informed us it was gonna be Humana is who they would all enroll in without a cost to the individual. But it means a change. And I don't know if all those enrollees received their Humana cards timely. The other piece of this that was frustrating for our residents was there's an annual health plan selection. So every year, the state gets a determination of what plans are gonna be available for what county. Typically, I wanna say that's maybe early to mid-December that that information goes out to our enrollees who then can choose if they wanna change their plan at that time. That has still not gone out to our enrollees. Because of the changes, from what I'm hearing on the state level, because of the changes with Medica acquiring UCare, there was a delay. So if memory serves, January 14th is the first notice that will start to go out for those individuals to pick a health plan for January of 26. It has caused a massive amount of questions from our enrollees to our teams, because we are the face, we're the people that they ask when they have questions about their insurance. We've done our best to inform them when we hear from the state what that is, but unfortunately a lot of our responses have been we don't know much either. Here are plans. We've referred them to Minnesota Aging Pathways to try and help with some of those questions, but until recently, we didn't even know which plans would be available for these enrollees, so it's been difficult.
And then you mentioned too, I don't know, if I may continue,
Go ahead, Mr. Winter.
that the state used to handle all this, and then now they kicked the can down to the counties?
So not everything. The piece that moved to the county was those 80 renewals that would normally be handled at the state level. So any case that was Minnesota Care, that's always been handled at the state level. I think mostly because it's premium-based and they handle all the billing. New this year, they decided that counties who had, if there was an MA case attached to that Minnesota case at all, counties could do that. So again, that was another 80 renewals all in a month. That's already very difficult to be processed by our team.
Thank you. Again, Ashley gave me enough information just to be dangerous. Like that, I yield back to you.
Thank you, Commissioner Wincher. Commissioner Casper.
Thank you, Mr. Chair. Ashley, question to you. Now, you said there was 19.4% on medical assistance. Can you tell us what the numbers were in prior years? Do you have any idea?
That I might have to get back to you on a percentage-wise. I can tell you, I do have a breakdown for each year of persons on. So if we take a peek at Morrison let me see, I just want to double check that I have both the Maxis and the Mets numbers here. Because they're two reports in two different areas, so that's super fun.
I see. Yeah, there you go. You don't want too handy.
Ooh, I do have both. Okay, so would you like a particular year for me to focus on?
Yeah, I'm just curious, over the last several years.
Okay, so if we look at, and these won't be combined, so I'm gonna give you two separate numbers for these
Okay.
ones. So if we look at 2024 persons on, there was in Morrison, 5,297 that were on in that MET system, so that's the adults and parents and children.
And what was the percentage then? It doesn't
I
list it.
don't have the percentage.
Okay, and it was 6,000 some?
So
In 25?
in 25, so what I'll do is I can read through each year.
Okay.
We'll start with the MET system.
Please.
So in Morrison in 25, persons enrolled was 5,184, just in the MET system. In 2025. In 2024, that number was 5,297. In 23, so again, this is kind of when those changes start to
Post-COVID.
implement, yep. So in 2023, that number was 6,570, and in 2022, it was 7,093.
Oh.
And then if we look at our elderly and disabled population. All right, in 2025, persons enrolled who are elderly and disabled were 1,402. In 2024, it was 1,417. In 2023, it was 1,563. And in 2022, it was 1,569.
Okay, so the numbers have been relatively stable.
For our elderly and disabled population, we saw a loss of about 150 from that pre-COVID rule to
Sure.
the current. We saw much more in the Met side. That's where we saw about 1,000 drop off from that side.
Thank you. Mr. Chair, one more question.
Yes.
This is a really pretty poignant, but do you see in your estimation, and Nate, you as well, do you see a bloated program, or does it seem like it's serving well?
Mr. Chair, Commissioner Casper. I gotta pick my words. I don't see it as being bloated, I guess. I think the COVID rules definitely bloated it, because there was some of those individuals who got to stay on longer than what they would have truly been eligible for. I think where we're leaning down to or weaning down to is more of an accurate number of what is stereotypical. And looking at like the pregnant individuals group, I think that 275%, I mean, put my public health hat on, I mean, those are the individuals that you want to be covered because they result in healthy babies, and healthy babies in Morrison County make strong individuals at some point to continue to support the work we do here. And so No, I don't feel like it's overly bloated, other than I think those COVID years were a little high.
I would agree completely with that.
Very good, so it's leaned out some. There's a fine balance there for the needy to help them, and yet not for people to use it as a crutch instead of working for a living.
Correct.
Thank you very much. Thank you, Mr. Chair.
You're welcome. Further discussion? Further discussion. I have a couple of points. You know, on the screen in front of us with the, and kind of to Commissioner Lemire's look at number 2, and that extent of coverage for children under 7, and also the extension for pregnant mothers out there too. And so I want to address this from the perspective of the critics of these type of social programs to help those in need out there who have long said there is no exit from these programs, or the benefits of these programs continue to roll to individuals with no oversight or no encouragement. I look at these changes on there with modest extensions out there to individuals who probably carry the greatest need. We're talking about children who are basically at entering school age, and then also pregnant mothers out there. Do you agree that these extensions are justified, even though these are not, as Commissioner Lemire pointed out, these are not they're not without end. They do have an end date, but what has happened with this change is a better hand or help to critical individuals for a little bit greater length of time. Is that a fair assessment?
I think that would be fair. I mean, the piece that's hard for our team with some of these extensions is the additional work that goes with it, because the systems are not set up with these exceptions, so it becomes a little bit more cumbersome on the worker itself. But I would agree that I think that population definitely benefits from being on MA, and as you said, there is a limit. There's a time when those extensions end. So I would agree it's not a program that you have to stay on. And on that sense too, I really feel passionate about the cost-effective program. Part of that reason, I think, falls into your not necessarily having to stay on the program. Is when an individual enrolls in a cost-effective plan through their employer. Once MA say they continue on that journey and then end up getting raises and fall off because of income purposes. They already have the plan that they've been on. So now, yes, it does mean that there is an additional cost to them because they've fallen off this MA program. They're no longer being reimbursed, but I think that makes such a smooth transition when someone has been enrolled in that cost-effective once they exit their MA.
Yes, and I agree with you. I'm going to come back to what you had just mentioned here briefly about that extension of work and reporting and that. But before I do, I want to ask Nate, I want to ask you a question. With this acquisition by Medica of UCare, and from the outside, we look at this as now we have, and you correct me if I'm wrong, but the only insurance providers out there would either be Blue Cross Blue Shield or now Medica to provide that coverage out there in this sector. Is that true? And how concerned, if that is true, how concerned should we be about lack of competition to help control costs in the future?
Mr. Chair, there's a handful of other insurance providers in the state. I didn't bring the dates with me because I didn't know if we'd be discussing insurance procurement cycles. So I think that's coming up, 26, 27, I don't know the exact year. But there's still Health Partners out there, there's still, I think Prime West, and there's still Shaw or South Country, that are still available in the state. I don't think I'm missing other ones. We mentioned Medica and Blue Cross Blue Shield. And so there's still some providers kind of out in the arena, and it'll be interesting to see, I guess, the next round of procurement for all the counties as they kind of select insurance plans. You're required to have two. My prior days, I think when I left Crow Wing, we only had two there. I was surprised that there was 3 options when I came down here to Morrison. So 2 is fairly typical.
Okay, okay. You know, I'll wrap this on my end anyway. In the sense of encouraging this communication and interaction, I look to you, Ms. Ashley, to do not be nervous and do not be hesitant to come and talk with the board here in 2026. And obviously, we get to see Mr. Bertram here, and we welcome him and his input here too. But obviously, there's a lot of discussion in the news about things happening at the state level with influence on the federal level, into looking at what's happening on a lot of programs in the state of Minnesota. We recognize the fact that there may be significant changes that may take place, significant scrutiny or accountability measures that become implemented in here that will not only impact this board's look at how we address budgets, but also we'll need to be kept in the loop about these demands on human resources, the amount of work that may be shifted or demanded of counties to provide accountability out there. Please don't hesitate to contact our administrator or the board to come and share with us some of those challenges and/or opportunities that always come with challenges, and vice versa, because I think that's going to be extremely important for myself and this entire board, especially as we go through the year. Gentlemen, further comments?
I
Commissioner
do.
Lemire.
I just want to make sure that there's no misconceptions on my feelings on number 2. I think it's irresponsible of the state to give auto renewal coverage for a child from birth till 6 years old. If the parents have the ability to pay for health insurance for their child, they should pay for the health insurance for their child. And with that being said, it is a very big benefit, and they should have to every year prove that they deserve that benefit. It's a small thing to ask for an expensive product.
And-
That's all I had to say. I just didn't
and-
want you to think, I'm that critic that you said questions this stuff.
And-
That one
and-
I question.
And thank you for that, Commissioner Lemire. And we all have that role to play to critique all of these things that we do that come through our purview, and we have that fiduciary responsibility to all of the residents of Morrison County. What I just stated to Mr. Bertram and Ms. Ashley is there will probably be a greater level of scrutiny and/or ask of accountability, just as you are saying, Commissioner Lemire. And we recognize that, and I believe would endorse that. But we also recognize the fact that we also have a responsibility to make sure that we're providing services to those who are truly in need, and that they are there.
And by doing that annually, that is ensuring that those that are truly in need are still receiving their services.
Exactly.
I just think it's responsible use of dollars.
Yep.
Absolutely.
And
I just didn't want to be misinterpreted.
Ebenezer Scrooge.
So that's all I was trying to get across.
And I
don't-
appreciate that, and I afford you that clarity, Commissioner Lemire.
And I still want kids to be taken care of.
Without a
It has
doubt.
nothing with that, so.
Without a doubt.
Thank you, Mr. Chair.
You're welcome. Further discussion? Okay. Mr. Bertram, Miss Ashley Effinger, thank you very much for your presentation, and know that this board may be inquiring to you, even if it's just to help us understand some of the acronyms.
Thank you very much.
Very
Chair.
good job, Ashley. Thanks, Nate.
Great job. Happy New Year.
Mr. Chair, I believe we have fingerprinting on the agenda, so I have some handouts for you.
Perfect.
You're welcome. No, you.
Thank you, Nate.
Thank you, Nate. Appreciate it.
Gentlemen, we, at our, I believe at our previous meeting, the topic of providing fingerprinting within that department of HHS up there. And there was discussion and inquiry about, could we bring this topic back for further discussion and reconsideration, I believe would be the right word. So Mr. Bertram agreed to bring this back, and I will let Nate lead this discussion at this point in time.
Yeah, Mr. Chair, so a couple things, not gonna go word for word and line by line through this. The top there, you kind of see our revenue trends for the last 3 years from fingerprinting. Again, this isn't a huge revenue draw. In 2025, we made about $4,523 for the work we do here. You can note that it is ticking up. And yes, my guess is if we continued this in 26, it probably would go up a little bit more with Crow Wing County recently ending their fingerprinting services. So, maybe 5,000, I would say, is what 26 would look like if I had to project that out for us. Just some of the stats. So in 25, we completed 1,260 appointments, which works out to be about 4.8 appointments per day. We had 54 no-shows during that time frame. Excuse me. And then, you've heard me note a couple times the struggles with the vendor and the equipment. This isn't perfect estimate, but as much as we could kind of gather going through some of our calendars and emails, this is roughly what we came up with was about 14 weeks worth of issues. 3 of those weeks were due to just equipment issues, with the equipment not working and having to wait for the vendor to send us material or equipment. And then 11 of them was due to IDEMA Identigo not having a trainer to train in our staff. And so we did our own internal training and we kind of kept the program going 1 day a week as much as we could, but in theory, we weren't supposed to fingerprint people other than the trained staff, which was Shannon, our supervisor, and one other staff at that time. So we lost a lot of time at the beginning of the year during that time. I'm gonna jump down to the current status. We started talking about ending services with IDEMA during budget season. I think that might have been first touched on maybe in August, with the final decision coming in October. To end those services, we sent formal certified mail to IDEMA after that, and we received notice that they have received that October 29th. Shortly thereafter, we sent notice to our providers. Shannon and I met after that, going through our list to make sure we didn't miss anyone, sent out another round, which we caught a couple that we had missed. And then, as is right now, contracted services with IDEMA Identigo are noticed to end on 1/31/26, so the end of this month. I will note, despite Shannon and myself both reaching out at this point, just about coordinating and process with that, we have not heard back from IDEMA. So again, frustrations just with their part on responsiveness, which just speaks to some of the struggle of this. Probably the biggest update, though, since our board meeting last Wednesday, so we had heard a rumor that a provider in the community was looking at taking this on. So we did some follow-up. That indeed did turn out to be true. So Focus Living, local provider here for adult foster care, is working on that process. Again, it sounds like they have their paperwork, they're working on getting it filled out. Again, the struggle is they're having a hard time getting hold of IDEMA Identigo as well. And which kind of moves us into alternative options a little bit in my mind. So, as is and what is already set in motion is that we're to end this contract 1/31. If someone can finally get a hold of Identigo and we could get some dates maybe where Focus Living could start, we could maybe work on doing some kind of gap services where Identigo could work with Focus Living to become established and we just fill in the gap. The only problem or caution to that is I have no idea what that time frame is, and could be we did it for 2 weeks, it could end up being 8 months. It's really unknown until we're able to get a hold of IDEMA Identigo. I think another option we could potentially look at is retracting our contract termination notice, sending more formal communication to IDEMA. I would strongly suggest that we work at renegotiating that contract. I did go through that right now as that contract reads. We're required to offer that 5 days a week from 8 in the morning to 4:30. And so there's no way for us to reduce those hours to a contingent amount. So part of the reason of the staffing loss included in that is we essentially got to have one office support staff designated to do appointment at any time during any day. Because if someone goes online and fills that out, we're required by contract to fulfill that. And so some days we might have 12 appointments, some days we might have one, there's days we don't have none as well. So that's part of the hard part to manage with that. I think, you know, some question has come up about, well, could we charge more potentially for this service to try to balance out some of the staff time lost? Again, in that contract agreement, we're not able to charge more for the service than what they're already paying. And so that kind of leaves us just with that $4.50, I think it is, per application. So per appointment, that's what we get. Those appointments take 15 to 20 minutes if the equipment is running well. Often it's taking longer. That's kind of where we're at, and so I guess I will take questions or direction on where you'd like me to go. As I noted before, I think as things currently sit without retracting that termination notice and moving forward in another way, we're set to end at the end of the month.
So, gentlemen, before I open this up for discussion, I want to ask, for the media and for the public out there, for clarification. So who are these fingerprinting clients that we are serving? And to help us understand that need or question that need.
Yep, Mr. Chair, if I may. So there's two parts of this, and Shannon, as our supervisor, is kind of point on all this. So I asked her, I'm like, well, are we able to see who and where these individuals are from? Which we're not able to see that. I think I just wanted to get a breakdown of how many other counties are coming down to Morrison County to complete this. I have no way to get that number. What I will say in some conversations with some of the care facilities, and even including our own HR team. So fingerprinting backgrounding happens for most social service related jobs. So our own social workers do this background fingerprinting. In addition, care providers, whether they be nurses or students or CNAs or those trying to get a degree of that nature, work in that field, often get this background study for our care centers, nursing facilities, hospitals. Again, those staff working at like adult foster cares or daycares, they all go through this. I'm probably missing some one-offs, but.
Daycares?
Yeah, daycares, yep.
And their siblings, children
That would
live in
be.
the house also.
That would be correct as well. So those are the primary people who are getting this backgrounding style. There is another backgrounding, and I'll just briefly touch on it just to call it out differently. There's a BCA backgrounding, which is more the criminal backgrounding. That's what happens like at the sheriff's office and jail. And you do need that for certain jobs, but all those other ones are going through this process.
Okay. So gentlemen, the wish for this issue to be brought forward for further examination or reconsideration was at the previous meeting. So Commissioner Moran.
How often is the training needed? That you were shut down for a while because there wasn't training?
Mr. Chair, Commissioner Moran.
Mr. Bertram.
The training is just required once. So once we have one of our office support staff trained, they're able to continue to provide Identigo fingerprinting ongoing. I think when this became an issue, I think a good chunk of that team turned over, and not turned over and left Morrison County. They just went to other positions within the county. A couple of them went to eligibility teams or financial work teams, like Ashley was here before, so.
So if we trained a couple more people in, or would that just, it wouldn't be in their classification to go over there and help? Or could we eliminate that to where we had 3-4 people that could do it if necessary?
Mr. Chair, Commissioner Moran, we do have 3 or 4 trained right now. Again, it's just kind of that time slot of, it takes roughly half an FTE to provide this service, so that's roughly $20,000 to $30,000 depending on kind of where they fall in that office support pay grade, and we're recouping about $4,500, and so to some extent it's just a loss. I think when we're looking at our long-term plan coupled with Caseworks and discontinuing this together, the plan was to reduce an office support staff, which would be a savings of 50 and 70 at the high end once you include benefits and all that. Is there ability to reduce an office support staff with Caseworks alone? I can't really answer that for you now. I think Q3, Q4, we could evaluate that if you wanted to keep fingerprinting here. I don't want to speak to what that looks like because I just am not sure yet.
And then if Focus Living did take on the fingerprinting, would they open it up like the 8 to 5 that we were required? Would they let other, if I'm Focus Living, why would I want someone that's gonna go work at St. Otto's? Why would I wanna give them that benefit? Do they open it up to the whole community?
Mr. Chair, Commissioner Moran, I don't know their intentions a little bit. Part of me wonders if there's some, tax purposes where they might be able to put it as a loss against the business. I don't know that. I'm just assuming, I guess, to some extent. I do think, though, some of that sounds like it can be negotiated in that contract. I was talking to one of the care center directors, and they were talking that they had done IDEMA Identigo at one of their other sites, I think southern Minnesota or eastern Minnesota. And their contract only said they had to do it 2 days a week. Well, that's a lot nicer because it condenses all your people into a couple days a week as opposed to spreading them out over 5 days, and you got one person a day here and 4 here and 8 here. And so I don't know what Focus Living would do as far as timeframes if they do 1 day a week or 2 days a week. Again, I think we've talked to them, we talked to them Friday and Monday, so basically every day since our last board meeting, just trying to get a feel for where they are, when they might be able to start, and I don't have a date for you on that.
Okay, thank you.
Further discussion, Commissioner Wincher.
I was just looking at my cell phone here I think all of us commissioners got a handful of people that emailed us about this here. The one I was trying to wrap my arms around is senior living. This gentleman or lady stated that they get charged $10.50 per fingerprint. Who's charging them the $10.50 per fingerprint? Is that the state of Minnesota? And then we get charged $4.50? And then I just wanna, and correct me if I'm wrong, when you say we have revenue of $4,500 in 2025, that's how much we had coming in from the people, but it's costing us about 20,000.
Correct.
So really, I look at it, it's a negative revenue, but if you could answer, and I got a couple more maybe, if you can answer this question.
Mr. Chair, Commissioner Wincher, Matt was in the office when I had conversation with one of our care providers, and so they noted that it cost them total at their end about $45 per backgrounding application. And so when we were talking through this, it's kind of interesting because she knew what she knew and I know what I know. And so we were talking about, she asked, what does the county receive out of that $45? I said $4.50. And she was just kind of aghast by that. And so we get probably less than 10%. Where does that go? I don't have an answer for that. I'm assuming the middleman, IDEMA, somewhere gets their chunk in there, and I honestly don't know where the rest of it goes, if some goes to the state or, and just a note, I mean, the IDEMA Identigo contract was in place before I started here, and so I wasn't involved with any of those initial negotiations, I guess, so to speak, so.
And I have one more, if I may.
Commissioner Wincher.
You bring up IDEMA and Identico, or that, who are they exactly? Is that the state of Minnesota, or is it, when we said that we put in our notice to, at the end of January, that we'll get rid of the fingerprint, have they even acknowledged that yet? And then moving forward, when you bring up this contract, can we, is that, like you mentioned, maybe it is negotiable, so if we're gonna, I would at least like to break even, you know what I'm saying? If we're gonna continue this, I'm not into it to lose money, but hey, we're not here to make money, we can break even, but as it continues down the road, yeah, it just doesn't look good for the county. If you may address that, and I can yield back to you, Mr. Chair.
Mr. Chair.
Mr. Bertram.
Commissioner Wincher. So, a couple parts to that. So we did reach out to IDEMA, probably in the beginning of 25, maybe it was even the end of 24, asking about if we can increase our rates. We didn't receive a response on that. As far as who IDEMA Identigo is, They're a nationwide business, so I don't have a count for you. There's a number of states, maybe a dozen or more, that use this service for their backgrounding services across the nation. And so they're a rather big organization who specializes in this, I guess I will say. I think their customer service is lacking. That's my opinion, I guess.
That's a
That-
great opinion.
Yeah. Part of the reason we made the decision to send it certified mail is so we had that receipt of when they did receive our notice. And so I just didn't trust their customer response to know if they got it or not got it. And so we sent that certified mail so we can say, no, you received this letter on such and such date and John Doe signed for it. So
So someone did sign.
someone signed for it and they received it, so.
For the discussion.
Mr. Chair, just one other
Mr.
piece.
LeBlanc.
And I think Commissioner Winter brought up state. So the relationship between Adema Identigo is they were awarded the state contract. So if we were to provide this service, they're the sole vendor that we must go through and use. So that's that relationship. They're not part of the state, but they awarded the state contract.
So we're forced to go with them and we can't bid out to Joe Blow or whatever.
That would be accurate. My understanding is the state is supposed to RFP in 26. I don't know if that means different vendor in 27. I'm not super familiar with the fingerprinting RFP process at the state level.
I got, Mr. Chair.
Commissioner Lemire, help us.
So we make $4,500. It costs us 20,000, and is it plus a half FTE? Well, half FTE would be more than 20,000.
Mr. Chair,
Mr. Bertram.
Commissioner Lemire, yes, I mean, it really depends where they fall in that scale. Low end it's $19.90 an hour with benefits. We're pushing 50-ish, 60,000, and so, yeah, the 20,000 came from when we were in budget session, and we were probably looking at that half FT through that lens and kind of the revenue and how it offsets, so.
And then
Commissioner Lemire.
their customer service is atrocious. If they don't get back to you, this other company wants to be a part of them, they don't even get back to them. I don't know if we do anything, I would say we help Focus Living be successful. Or are they interested in allowing others to come in and do fingerprinting there, or are they doing it for their own sole purpose?
Mr. Chair, Commissioner Lemire. Well, I think partially it's for their own purposes, but any contract that I've seen and even talking with some others, I don't think you can, once you're a vendor for Idema Identigo fingerprinting, like, I don't think those appointments are put online and anyone can sign up for them. I don't think you as a provider can just say, nope, this is mine and I'm doing it for me. So I don't anticipate that. I will just put it out there, I guess, to the board. I mean, my team we can keep working on this. I can come back to planning session and board again at the end of the month and try to give updates as we go. It's not super helpful for community planning purposes, but it does allow us to pivot, I guess, as we go.
Sure.
Commissioner Lemire.
No, when you do fingerprinting, it's once, right? When you're first hired, or do you have to do it annually?
Mr. Chair,
Our social workers I'm talking about.
Commissioner Lemire, the social workers just have to do it annually, or not annually, as they get hired. But like daycares and some of the foster cares, there's intervals where family members and they have to be re-fingerprinted. I want to say some areas are 3 years, some are 5. And so there is not an annual requirement though.
And this identical services, if we continue to follow our plan, they have to go to St. Cloud to get fingerprinted?
They would have to go to St. Cloud. There's a site in Medina, a site in Alec, and a site in Aiken at the current time, one time a month. It sounds like the Baymont Hotel, Identigo, is coming up themselves and providing this service. We've also tried to reach out to ID My Identigo, cause it does sound like they will, like, they set up the shop at Baymont themselves and they administer that. There's no staffing from anywhere else. Shannon and I had some discussion about, well, what if we just keep our space and they can come do that a couple times a month, and would that meet Morrison County's needs? Again, it's really that communication piece and the two-way street with ID My Identigo that's kind of been the hurdle to try to get over.
And, Mr. Chair,
Commissioner
I
Lear.
read of, like a mobile fingerprinting. Is there such a thing?
That's kind of what they're offering at that Baymont. I don't know what
That's
that
a
looks
mobile.
like. Yeah, they're
Okay,
kind of,
sorry.
yep.
And then, I personally think we should either stay the course that we designed, our chess match that we designed, so we could have that half FTE to do other, HHS things with the new software. At best, maybe ask if we can help Focus Living for, 2 months, or have a hard deadline when we're gonna be done. Other than that, I would continue to stay the course that we set forth. That's my 2 cents. Thank you, Mr. Chair.
Mr. Chair?
Further discussion, Mr. Moran.
I talked briefly with a rep from St. Otto's, and he did actually have Identigo in there. I thought he said maybe 5 years ago. So I guess he might know how they operate, if this Focus Living is an option or not. Number two, the one thing that considers me is these schools are putting on this CNA class that they're offering to these young kids to get into the workforce, to maybe steer them to a nursing degree or something else. And many of these people that reached out were concerned that these kids who are currently going to high school are gonna now have to find a vehicle if they don't have the vehicle, get out of school and drive down to St. Cloud or wherever they gotta go. I just really think that we should look into it a little more, not just drop it. I think there's many benefits that these young kids who want to work and be part of this, I really think, and everywhere, when we originally talked about this before the first of the year, and all of these emails we got later, I wasn't aware of the impact of what it was, so I think we should definitely explore into keeping it.
Commissioner Casper.
Thank you, Mr. Chair. Yeah, and I think my fellow commissioners have fired a lot of questions, a lot of what were raining on my mind. But another question would be, is it possible to contact other counties that use Identico? Contact the state and ask them if they can rein this company in that's not doing their job. This is ridiculous. They've been hired, they're under contract, and they're not doing their job. They're costing all the counties that are part of it a great deal of money because they're so disorganized. And the other thing, Mr. Chair, I would say that I agree with Commissioner Moran that there's a lot of local folks, the nursing community that is using this. But if we can rein it in so it's organized, so you can have, renegotiate a contract, maybe raise the rate and rein the hours in so it's not all over the board. I think there's a few options to look at. I don't want to see, and I agree with my fellow Commissioner Lemire that we certainly don't want to cost in the county a great deal of money, but at the same time, if we can maybe curtail some of these things and make it effective, maybe that's something that can still be done for the sake of the local folks here. Thank you, Nate. Thank you, Mr. Chair.
You're welcome, Commissioner Casper. Gentlemen,
I'm gonna throw one more out there if I may, Mr. Chair.
Commissioner Wincher.
We have, again, I don't agree or do agree, that's why we're having the discussion. This was part of our 2026 budget that we made last year. If we would decide to keep it, continue, I understand if we don't continue, that's part of the budget. Where would this money come from?
Mr. Chair, Commissioner Wincher. So the way the 2026 budget is laid out. So this office support staff that we had intentions of eliminating was to do by 2027. And some of that has to do with how CaseWorks is implemented and plays out. So to some extent, the position is there within budget, and so the savings of being able to reduce that earlier would mean we would draw less out of fund balance potentially, for keeping that staff the entire year. And that would prepare us for 27 and that reduction of that staff. Choosing to keep this is not gonna change the budget at this point. It would just change our plan of reducing that position, and how we had envisioned that to help offset some of the CaseWorks costs.
To offset the additional work from the state sent us.
Correct. Well, yeah, I mean, to some extent, because we talked about repurposing that into kind of that MAFBA position for the social worker and the African American Family Preservation Act, so. Thank you, Commissioner Linder.
So, gentlemen, you know, as I notation this discussion here and I look at this, you know, this is a service that's not required of the county. We're dealing with a unresponsive and a sole vendor, which means we don't have options to look at competition to improve services. I mean, I can't get around the fact that to continue to offer this service comes at a $15,000 loss. And we made that decision in October, as Commissioner Wincher stated. We made that decision as part of our budget decision, because at that time we recognized that we didn't want to participate in an activity that literally throws $15,000 away. I haven't identified myself, gentlemen, where there is an unforeseen cost that would be bore by our county employees if this process was allowed to expire as we had voted on in October. So we're at that point, gentlemen, that I believe we need to make a decision here today. And we either need to, and we're gonna have to probably take a vote on this, to either let this contract expire as we had decided in October, or if through this reconsideration here this morning, there's been a change of heart that we should change and retract our termination notice to this company and continue and look at continuing to provide this service. The third option out there, which I will share that I have uneasiness with, would be to somehow spend some time negotiating with an unresponsive company to see if we can somehow find a way to butter our bread, I'll say, in a positive way. But we're at the 6th of January today, correct?
Yes, Mr. Chair.
You know, and we have a correspondence that went to this company, unresponsive or not, that, and they received that this contract would expire on the 31st of this month, so that's, in my math, 25 days from now. And is that the best use of staff time at this point in time?
Mr. Chair,
Mr. LeBlanc?
hearing some of the feedback or concerns of the board and input, and also combining maybe your number 2 and number 3, and with the position being budgeted for 2026, I might propose, if we're able to, a 90-day extension not to exceed April 30th to assist with the transition to focused living if they take this service on, or to do some of those other pieces of negotiating contract with Identico, and then ask Mr. Bertram to come back to board in late February, early March with an update to provide that, again, gap service for the community.
Thank you, Mr. LeBlanc, for sharing that with us as a potential option. Mr. Casper?
Mr. Chair, I would make a motion to accept what our administrator had put forward.
If you could explain your motion?
Yeah, once again, Mr. Chair, if I may.
Mr. LeBlanc, thank you.
What I was.
I'm sorry.
What Commissioner Casper made a motion on was to extend our services not to exceed April 30th of 2026 with fingerprinting with Idemia Identigo if they allow, after we have served notice of termination, to assist with transition to focused living or to renegotiate contract with Idemia Identigo, and then with the department head here to come back in late February, early March with an update on that service.
You understand,
I
Commissioner?
understand. I have a comment, if I may, Mr. Chair.
Before I open this for discussion, is there a second to the motion made by Commissioner Casper?
I'll second it.
We have a motion and a second. Now we have discussion. Commissioner Wincher?
Thank you. Question I have, again, I'm a little concerned if we stay in it, because they might cancel us anyway, because even if we do kick the can down to April, you know, besides, they're just not giving us any service whatsoever. So who's to say that we would even have the coverage that, whatever it may be? I would be, again, and I appreciate my colleague's motion and second, if we could get back into this, so we could kind of stay on the forefront, you know, maybe if it takes May, June, or whatever, and see if we can negotiate this. Then, if they allow us to raise our rates, you know, however it is, I don't know, maybe we could meet with some of those state representatives, because that's where I think, yeah, I think it's a valuable product, but at this time, we did make that decision back in October, November, that we would discontinue this, and I'm gonna state that's what we have to go by. We have a handful of emails, I think I got 4, and again, the CNA and Commissioner Moran brought that up. I think that's a very important thing too, because again, that's a tough job, in my opinion. But to move forward, I just think, Mr. Chair, that at this time, if we could get back into it down the road, again, the service they provide is unbelievable. It's just like, what do we do? If we say we want to be back in it, is it gonna take, we have to send them a certified letter again? I just think we just keep moving forward what we have and go from there.
Commissioner Lemire?
I just want to say I won't support that motion. That's part of the budgeting process. You make the tough choices and you stick with the choices that you made. If we didn't know that there was repercussions of not doing fingerprinting anymore, then our heads were in the sand. It's obvious that there was going to be repercussions. We have a plan. I think we should stick to our plan, and I don't think we should renegotiate with individuals that are totally irresponsible. I think this is a nice shot across the bow. Maybe they'll get their act together. Maybe the state of Minnesota will get their act together. If Crow Wing County quit, no, we quit, maybe it'll entice others to follow that lead, and there'll be a problem, and a problem needs to be solved. Maybe the state of Minnesota, which they usually can't solve nothing, but maybe they can come up with something to solve this problem, because it's obviously a problem. So I will be voting no. Thank you, Mr. Chair.
Further discussion? Gentlemen, further discussion? Further discussion, we have a motion, we have a second. Gentlemen, I'm gonna call for the vote, and this will be a roll call. Commissioner Casper.
Aye.
Commissioner Casper votes aye. Commissioner Wincher.
Nay.
Commissioner Wincher votes nay. Commissioner Moran.
Aye.
Commissioner Moran votes aye. Commissioner Lemire.
No.
Commissioner Lemire votes nay. The chairman votes nay. Gentlemen, the motion does not pass. And with that action being taken, that means that our decision of October will stand and this contract will expire on the 31st of this month.
And if I just may, Mr. Chair?
Commissioner
I would like to
Wincher.
have Nate maybe just kind of stay on top of it, just to see what the heck comes about this, but we don't get no response. But again, I appreciate that, don't put too much time and effort in it, but just to see what the heck they're doing.
Mr. Chair,
Mr. Bertram.
yeah, me and my team will keep trying to coordinate this throughout the end of the month, and we'll give you updates as we have them. But certainly before the end of the month, we'll be back. And Mr. Chair, if I may, one other thing. So each year in March, Health and Human Services has helped lead food shelf fundraiser as a county as a whole. So just to note, our local food shelves in 2025 assisted 10,376 individuals, distributing a total of 299,000 pounds of food. And there's 318 new families. Last year in 2025, Morrison County as a whole was able to raise $8,012 that were split across the 3 food shelves in Morrison County. And so I just want to look to ensure we have your support. It doesn't cost us anything per se, but it does take some staff time.
Gentlemen?
Got 110% of my support, Nate.
Yeah, mine as well.
Good job, Nate.
Perfect. Thank you for doing that.
Gentlemen, and Nate, gentlemen, out of respect to our Director of Health and Human Services and certainly to our administrator, I would ask for your interest and consideration of the previous topic if there were to be dramatic changes that are uncovered, if the board would entertain having further discussion on this before the end of the month. Thoughts?
If I may, Mr. Chair, when you're stating that you want additional, if something would come up and they get back to us and say, hey, yeah, we'll pay you $20, is that what you're saying? Is that-
I'm saying if there is a greater reveal through communication that takes place between now and the end of the month, if there is the desire to bring this issue back for discussion or thoughts.
I think it's reasonable, Mr. Chair.
Yeah, I'm okay with that.
We will monitor that, and I only mention that because you had given that direction to both those individuals to keep us posted, so, just so I know whether or not we bring this back before the board. Anything further for our Director of Health and Human Services, Mr. Bertram?
Thank you, Nate, for everything.
Yeah.
Yes.
Thank you.
All the info,
Thank you,
appreciate
gentlemen.
it.
Keep up the good work.
Gentlemen, next on the agenda, Public Works. Good morning, Mr. Hennon.
Good morning, Mr. Chair. Good morning, Commissioners. Tony Hennon, Morrison County Public Works Director, County Engineer. Mr. Chair, I have one item for you this morning. We had our first bid letting for the 2026 construction season in December, so we'd like to review the abstracts with you. So this bid letting was for our County Road 225 and our CASA 21 box culvert replacement projects, SP 049-598-031 and SP 049-621-021. This is contract 321. Go over to the next page here. And we have two locations here, two separate plans, and then just one single contract. We have external funding. Both of these projects receive federal funding to help facilitate the replacement of these structures. Go to our next one, Matt. We had a very nice bid turnout. The bid letting was on December 18th at 10 a.m., and we had 5 total bidders. We had an original engineer's estimate of just over 1.9 million. Of those 5 bidders, we had a split. 2 were underneath our engineer's estimate and 2 were above. The low bidder, Marvin Treader, came in at $1,486,819.56. That was 23% underneath our engineer's estimate. So obviously, we were very happy with those numbers. We hadn't seen numbers like that in a box culvert project for a long time.
Close
So,
too.
yeah, if you look at our number 2 and number 3 bidders, all that bidding is very tight between Midwest and Landwehr, our 2 and 3. You know, those bidders were within a couple $1,000s of each other. So good tight bidding. You know, from an engineer standpoint, that typically means our plans are pretty solid, so we shouldn't expect too much from the likes of change orders, hopefully. Is there any questions on the bid abstract?
I make a motion to accept.
So, yeah, Mr. Chair, I'd recommend authorization, a resolution to award this contract 321 to Marvin Treader of Pierce, Minnesota, in the amount of $1,486,819.56.
Gentlemen, we have a motion by Commissioner Casper. Is there a second?
I'll second it.
We have a second by Commissioner Moran. Discussion? Commissioner Wincher?
Just to make a note, we've used Marvin Trail before.
Mr. Chair, yes, Commissioner Winster, Marvin Treader Inc., they've done a lot of work inside Morrison County. They had our box culverts this past year in 2025. The previous year, 2024, they had box culvert projects and also were a subcontractor to a bridge job. You know, a very reputable contractor inside Morrison County, and we're fortunate to have them bidding on some of our work.
Further discussion? Further discussion? Seeing none. Gentlemen, it's a roll call. Commissioner Casper?
Aye.
Commissioner Lemire?
Aye.
Commissioner Wincher?
Aye.
Commissioner Moran?
Aye.
The chairman votes aye. All those voting in the affirmative, the motion prevails.
Mr. Chair, that's all I had for you this morning, unless there's any questions from the board.
Questions for our engineer?
Just a statement, Mr. Chair.
Commissioner Casper?
Your road crew has been severely busy over the last month.
Mr. Chair, yes, Commissioner Casper, the weather pattern definitely has changed compared to the last 2 years. You know, the staff, I think, was pretty eager right away to get going, but, you know, we could go for a little break right now. We were fortunate, a lot of that freezing rain was south of Morrison County this past time. We only had to send a couple spot trucks out this morning, but I think they're down enjoying themselves just with a little bit of tree work today instead of sitting in the plow truck. And from an equipment standpoint, you know, we're making a bunch of repairs right now on some of our down trucks, so a little relief is definitely welcome.
Good. Very good. Thank you.
They do a really good job too.
Yeah, tell them
You wanna
thank you very
forward that on
much.
to them.
They've done
Absolutely.
fantastic.
I'll pass it along. Thank you, everyone.
Yep.
Absolutely. Have a great day.
Do we
See you Friday.
schedules and that before? Do you have anything else in the administrator's report?
Gentlemen, before I go to the administrator, we're gonna go to number 12 and do our committee reports and schedules. And, of course, we'll ask Tabitha for dates that she would like us to review.
Thank you, Mr. Chair. January 19th through January 30th.
January 19th through the 30th. Commissioner Wincher, start us off. Hit lead off.
All right. On the 21st, we have a board at 9 a.m. And I believe there's, excuse me, I'm.
Got the wrong month?
I'm looking at April.
Sorry.
No,
You're way
that
ahead of us.
apologies, I was.
Sorry, ground ain't thawed out yet.
Yeah, I have to get through On the 20th, we have a planning session at 8:30. On the 23rd, I have soil and water at 8:30 here in Little Falls. On the 27th, I have board, and it goes to the 30th at 9 o'clock. Otherwise, you have me there. I'm good.
Fantastic. Commissioner Moran?
Wednesday, January 21st, at 5 o'clock, virtual with Hands of Hope. You said the soil and water, okay, and then the 28th, I have,
If you want, you can go more on the soil and water. I'm gonna be at the meeting, but you're.
there is a lunch that we're invited to at 11:30 on the 23rd here at the boardroom with soil and water. And then the 28th, Central Minnesota Emergency Services Board, 1 o'clock at St. Cloud City Hall.
Commissioner Casper?
Yeah, Mr. Chair, is it a fact that we have a PC BOA on the 20th, on Tuesday?
Should have. I don't know if there's anything on the agenda. but-
Okay, so we have PC BOA that evening. And then, for myself, on Friday, the 23rd, Mississippi Headwater Board at 9 o'clock up in Walker. And, oh, and I skipped, also on the 20th, I have Great River Regional Library that Tuesday at 5 o'clock in the afternoon. That's it, Mr. Chair.
Commissioner Lemire?
Just one thing to add, 28th, HRA, 9 o'clock.
And Ms. Tabitha, I can add a couple of things too. First of all, the SWCD luncheon here on Friday the 23rd at what time? 11:30?
11:30?
11:30? Here?
That's right.
Thank you. Tabitha, on Wednesday, the 21st, at 10 o'clock a.m., I have a Region 5 Exec Board meeting at their office in Staples. And then the following day, on Thursday, the Region 5 Commission meeting will be at 6 PM with election of officers as part of that agenda. And that should take care of me. Thank you, gentlemen.
And if I just may, on the
Commissioner Winchell?
20th was brought up, there is no PC that night. There's nobody, it's just,
No planning commission, but there's a,
just adjustment- Board of Adjustments, yeah.
okay, thank
And
you.
I don't know who has Scandy Valley or Pulaski for Board of Adjustments.
That's where the variances are coming from.
Mr. Chair.
Mr. LeBlanc.
And the 19th, the Government Center will be closed in observance of Martin Luther King Day.
Oh, thank you for sharing that with us. Courthouse closed. Anything else regarding schedules, committees, anything else? If not, at this point, gentlemen, I will look to our administrator.
Thank you, Mr. Chair. One item for discussion today, and that's a request to go into closed session for ongoing litigation matter in accordance with Minnesota State Statute 13D05 Subdivision 3B. That is in regard to the land and trust and with the IBIA that we have been in discussion with over many, many times. And today is just a follow-up discussion from last month.
Gentlemen, I'll entertain a motion to go into closed session.
I'll make a motion.
Motion by Commissioner Wincher, is there a second? Second by Commissioner Casper. Discussion, seeing no discussion, all those in favor signify by saying aye. Aye. Those opposed. Gentlemen, we are in closed session. We will begin discussion in